So our next presenter will be Pravin Sonawne. She will be talking about understanding the needs and experience of transgender individuals, a mixed method study of the Pune branch of integrated services. Uh, Pravin Sonna, also known as Purvi, is a development sector professional with over 18 years of experience in health, family planning, HIV/AIDS, and RMNCH+. They hold a master degree in social work and specialize in safe abortion services and comprehensive sexuality education. Praveen is a member of various committees in educational institutions, has presented at national and international forums, including ICFP 2022. As LGBTQIA activists, they are dedicated to empowering vulnerable communities and were a founder of India's first transgender dual Tasha Pata Shikandi. Over to you, Praveen. Sorry if I mispronounce any of your name.
Thank you so much for the lovely introduction. And I'm used to for that mispronunciations because we, the LGBTQI community, we are into a fluid gender sexuality as well. Okay, so majority times our pronouns are mispronounced, but we are okay with that only because everybody is in learning stage. Okay, so I go with the pronouns of he, she, and they, and I identify myself as a queer trans person. And there are so many other several categories which people are yet to understand and learn as well. So with that, we will start with the presentation. In my presentation, along with the other things, the background is also very, very important. This is a study from FPA India, Pune. We have a clinic in Pune, and the background of the program is very interesting. As I said, that unlike other like other South Asian countries, India also have a lot of challenges in accessing comprehensive services when it comes to transgenders, and that too mainly gender affirming services. And all the barriers are stemmed from deeply rooted societal stigma, discrimination, lack of healthcare providers, and also knowledge around it. So that's the main barrier. And all these barriers come to one path or one place wherein you can see a lot of discriminations at the service providers level, which transgender community is also facing. Okay, not only in India, but I was also studying about Sri Lanka. Everywhere the situation is same, and these barriers are resulting into something very, very vicious or something very dangerous for the community itself. One thing is, because of these barriers, there are private practitioners, those who are privately practicing, knowing and having the good knowledge, but they are minting the money out of it. That is the first thing, because the services which are provided by them are at really, really high cost. One. Secondly, they are not following any of the guidelines. In the previous time, there were no guidelines, but recent times we have WPATH guidelines, IPATH guidelines, but those guidelines are also not followed by those private practitioners. So pre and post care is not at all available. Only the mid care during the surgery or the therapy, those cares are available, but pre and post, there is nothing available. At the same time, these are only available in urban setups, not in rural setups. So all transgender community have to go to those setups, and they cannot access it unless they have a lot of money. And majority of my sisters, my brothers are forced to get into sex work in order to get those surgeries. Do we agree with that? Of course, all of us. Either you have to be born rich or you have to shell your body to get done on your body. That's the first thing. Secondly, because of this, there are along with this, there are other problems as well. There are no other healthcare providers, those who can provide, there are no specialized healthcare providers in public settings. That is one thing. Secondly, the knowledge about the services is not much with the community and the service providers. At the same time, The scarcity of facilities, specialized expertise, and high cost also pushes all the transgenders to a dangerous situation. And many a times, as a result of this, majority of them go for self-medication, especially in hormonal therapy. And self-medication is a very dangerous situation because it can lead to many issues like cardiovascular issues, liver problems. Then they can have some cancers because of imbalance of, they are prone to get some cancers because of imbalance of hormones, and also bone density goes low. So there has to be a medical expert who is looking at that transgender when they are medicating. So that's the main problem when it comes to transgenders, those who are accessing hormonal therapy by themselves. All these things are very, very dangerous for transgender community. But as I said that having lack of resources, money constraint, they are pushed to have things on their own. And majority times, if at all something is prescribed to me, my other 10 friends will come to me and will always opt for that without going for LFT, RFT. Those are the things which they are supposed to go in the beginning. That's the reason the background is very, very important. FP India Pune branch is serving LGBTQI community since 2008. And since then, we are working for HIV prevention, STI prevention, and treatments referrals. During the pandemic, many transgenders approached us for seeking help in terms of dry ration kits because they couldn't beg, they couldn't do sex work at that time. And that's the reason they requested. That was the time when they requested, they started coming to our clinic. Prior to that, we were going to them through mobile clinic vans. But at that time, they started coming to our clinic to collect those rations. And that time we had one form. It was a baseline survey. So we collected data and we asked their unmet needs or needs, demands, what they want. And that time they said that we would like to have services under one roof. And that's how this clinic has come up. This clinic, we call this clinic as one window approach. And that's a clinic wherein we are having several services. Based on the service accesses, we have done the study, and the objective of the study to document the range and volume of services like HIV testing, STI testing, NCD screening, and also gender affirming services like laser hair reduction and hormonal therapy. Second objective was to evaluate the client satisfaction and their feedbacks to improve. Third one was assess the effectiveness of one window. That was the approach we started with, but right now we have a clinic, and that's a very, very interesting and integrated model. And to identify challenges and areas to improvement, because whatever we started, just trial, but we have continued from 2020 till 2024 now. In methodology, 750 transgenders are interviewed. It's a client data record. I mean, we have several documents wherein client data records are there. Then the data triangulation was done. At the same time, we had a qualitative survey. We had feedback surveys. We had client exit interviews. All these things are inculcated in the in this complete research. Local ethical committee suggested that we should not exceed than 750. Previously, when we started with baseline, we had only 650 transgenders, those who came for baseline or collect the ration kit. But over the period of 4 years now, we have more than 900 transgenders those who are accessing services. Special attention, 45 transgenders have given their interviews about the services, about the service accessibility, and how friendly or how inclusive the clinic is. Result section talks about many more things than that of whatever is depicted here. If at all we are interested in understanding the success stories, then the success stories are like majority of them have undergone laser hair reduction. All the 750 transgenders which I mentioned, they are the transgenders, they came to our clinic, and when they were accessing services or after accessing services, the data was collected. So all the 750 transgenders have undergone laser hair therapy at least once and more than 3 times as well. I think up to 85% of them have gone up to 3 times of services. Then we have TGs, those who are, if you see the demographic, 80% of them are into begging and sex work. So you can imagine what kind of amount they must be making. Our aim for the clinic was to cost or to charge a minimal amount of service charges so that they can access it and come back to us. There are private practitioners, those who are charging the same service for 5,000 rupees, and we are charging only 700 rupees for the same service in order to have a cost recovery basis, because we received a funding for a year from IPPF, and that's how we started the clinic. But after 1 year, we cannot stop the services, no? So for that, we started. So if you see, 18 to 55 was the age, and mostly transgenders who are below 29 years. Education, if you see, 85% of them were either literate up to HSC they have studied, but 15% plus people were postgraduate and graduates. So that's also a very remarkable thing which we noticed, that many of them are graduate and postgraduate as well. SRH services, of course, there were other services which were improving with the time. HIV services have gone up, even STI services have gone up. The linkages of positive people were also gone up. At the same time, in Pune, there are some other 4 organizations, those who are working for transgenders and other communities. We are not ought to give HIV and STI services, but still they are accessing those services at our center. That was one thing. At the same time, we have hormonal therapy. 45 plus transgenders are undergoing hormonal therapy. We have a visiting consultant who comes to our center, and we are giving referrals to GID certificate, gender certificate. Along with that, with the process, we understood that there are some other demands from the community. They want entrepreneurship trainings. They want to go for higher education. They also wanted some employability factors. So we also placed some transgenders, like 12 trans women and 6 trans men, to the local government security guard department, and that was a big success for our complete team. Is there any way we can place these videos? These are the videos which you are mentioning. That's India's or rather world's first Dhol Tasha Pathak. Dhol Tasha is a group of musicians. Drums are played. That's a tradition of Maharashtra. And till now, men and women were playing. And with this clinic, we also have some small group through which we started this Pathak. So if at all we can play that video, it's just a like 30-second video, if possible. Is that possible? The integration of services along with SRH and the other gender affirming services results in a really, really good thing. We have seen people changing their lives, and actually our aim has to be not only to provide the services, mainly if at all anybody of you want to start such kind of clinic or want to have inputs, you can connect us virtually or you can visit our clinic. The main important thing is always train your staff to have an inclusive environment. It is not easy. Sitting in a room talking about it, it's very easy. But when it comes to reality, when we are having providing services at SRH clinic, women are sitting and one transgender walks in, they don't like it. They either don't like it or they make a point that next time they are not coming. So we have to have a balance of both. Also, our staff, how they behave. If you train them well, they will be more friendly. They will be too friendly. That is also not good. If we have to train them to have an inclusive environment, we have to have a balance. That's what the takeaway from this entire thing. And these are the recommendations. These are few. This is how the laser therapy works. These are our TGs, those who are excellently doing well in food industry. And she is a very good makeup artist. She is an artist for one of the leading actress. We also have one transgender who is proudly known as a porn artist beneficiary. She is very well known porn artist. And that was a question from one of the presenters last time, why a porn artist name is given. But of course, that's also a profession. We cannot leave, I cannot leave this stage before, thanking these people, each beneficiary, all the staff, IPPF for giving small grant. But of course, the first step is the most important step. All the donors and all the listeners, all the panelists, and at the same time, chair and co-chair. Thank you so much.
Thank you very much, Purvi.